Okay, so this is the second part of the story, I guess, with supplements, taking supplements. Um, so anyway, I started taking the K2, vitamin K2. I was taking it for about 3 months before the doctor said, okay, well, because your calcium is low, you should start taking calcium tablets with each meal because it'll help bind your phosphorus. It'll be like a natural binder. So I said, I don't know about that. He said, oh, take 2 600 milligram tablets with each meal. And I said, I'm not going to do that because we did that before and it made my calcium go sky high. And then we had to stop everything abruptly. So I said, well, let me try. Along with the K2, I would take 1 600 milligram tablet with each meal. And so I came back the next month, and he said, okay, well, everything looks great. Everything looks fantastic. Keep up the good work. So I was like, I had a little secret, and I didn't tell him anything. So the next month I went back, and everything looked fantastic. My PTH levels were lower. My calcium was lower. It was normal. And my phosphorus was normal. And so he said, Miss Christmas, what are you doing? What are you doing then? Because he knows that I tend to do these things every now and then. And so I said, well, I'm taking K2. I spilled the beans because I really don't want to tell him because, every time you tell him you're taking supplements, they say, well, you shouldn't take that, blah, 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 it's not good for you. And it's true, you have to be very careful. So, but I didn't tell him anything. So I finally, gave it up and I told him that I was taking a K2 and he's like writing notes feverishly. I don't know what he was writing down. Because, this is huge, If a patient can get their calcium and their phosphorus under control, it makes their parathyroid hormone to be under control, and therefore, you get bone tissue restored, and perhaps, muscle tissue also re-strengthened, and all that good stuff. Everything, if you can control the parathyroid, you basically can control most everything else, And so, I believe at that same visit, the nurse at the clinic, under the doctor's instructions, gave me, I think it was 400 cc's of iron intravenously. And, I've had problems with iron before. One time I took iron like that. She gave me like a dose like that. I think it's 400 cc's. I can't remember exactly. And I couldn't sleep for like 2 straight days. She gave it to me on a Friday. I couldn't sleep on Saturday. I could not sleep on Sunday. And I was destroyed. And then I did a quick liver cleanse that night, and then I was able to finally sleep. I think. Well, I did it Sunday night, and so I guess overnight I was able to kind of sleep a little bit, and then Monday I was great. And so I was like, no, I'm not going to let them do that to me again, nevermore. But this time my iron was very low, my hemoglobin was low, and they said, okay, well, you really should take some iron again because you really don't want your iron to get too low. And I'm thinking about Danny Glover's father. Danny Glover's father died of anemia because he had some kind of chronic disease, and he had anemia, and it killed him. And I'm always thinking about that because, you have to be concerned about these things. It's a vital nutrient, and if you let it get too low, then you really are in trouble. So I said, okay, fine. Give me the iron. I'll take it. And then that day, because she gave it to me in the morning, and that day I went to do my next exchange, because I do 4 exchanges of peritoneal dialysis a day. Manually, I don't do the machine. I'll tell you why maybe in another video. And during that exchange, I felt a terrible pain in my upper abdomen, just a terrible pain. And then when I looked at the fluid that was coming out of the bag, it was bloody red. It was just red. It was crimson. And I thought, oh my God, what is going on? This is horrible, because it doesn't happen too often. Every now and then you get a little blood, but this is just like, it looked like it was just pouring straight out of my body, just blood. Like there was no fluid, just blood. It was horrible. It was just very frightening. I didn't tell anybody because, no, that's not true. I think I told them the next day, because my husband came home and he was alarmed when he saw the fluid, and because it was like 4 consecutive bags and it was still the same terrible, just rank red blood coming out of that fluid. And so I think I called him the next day and I said, I think that the iron may have caused an aneurysm or something in my peritoneum lining or something. And she's like, no, that's not possible. Iron doesn't do that. And I was like, you know what? Every time I do iron, something terrible happens, and I'm not doing that again. So I went the next month, and she was like, well, maybe you could just do half a treatment. Just do 200 milligrams. And I said, I don't know. And I said, okay, because I'm thinking again about Danny Glover's father. So I said, okay, fine. It's still low. Let's do it again. Just 200 milligrams this time. Don't do the whole treatment. So we did that, and I think I did okay. I was fine, but I'm thinking now, after like 4 months, because I think the next month I noticed that my parathyroid hormone levels had risen a little bit, and every month after that, I guess July, August, September, this last test, it was like up to like 1,700. Or was it 18? I think it was 1,800. I'm like, this is ridiculous. What is going on? I was frankly depressed after having been to the doctor, and I saw that, because I'm thinking, hey, I hit a jackpot here with the K2, and it's doing fantastic things. But I believe that the iron is what is causing the imbalance. So I'm going to try doing another liver flush tonight, maybe tomorrow night. I think tomorrow night, because I'd rather do it over the weekend. And see what happens on the next blood test, because I have to see the doctor at the beginning of the month next week. Next week is the beginning of the month, and so I'd like to be able to know what's going on with this once and for all. So anyway, like I said, in the previous video, you have to be careful what kind of supplements you're getting. Even if the doctor prescribes a supplement, you still have to be very careful, and you have to insist, because if I didn't insist on this iron thing, she might still be giving me iron, and I might have like a really bad reaction with the parathyroid, because you can imagine when you're given more iron, when you have, like, let's say, optimal iron levels, then I guess what's going on is that the parathyroid is thinking, okay, well, now I can grow again because now I have optimal levels. I guess. I'm not sure how these things work. It's a mystery to me, but I'm working very diligently to figure out how it works and what's happening, because the doctors are not going to do that for me. They know what they know. They've done their research since, like, let's say the 1960s, 70s. I think that's the best research that they did, and they're not really going beyond that. The only research they're doing with kidney disease beyond what they've learned back in the 60s and 70s is with transplantation, with more medication. Okay, well, if you take this medication, maybe it'll have less side effects. And that's not doing me any good right now, especially since I really am never going to have a transplant. I refuse. I'm not going to do that. So, anyway, like I said, you have to be careful with your supplements. Currently, I still take the K2, and I still take the calcium. And like I said, I think it's the iron is the culprit. Because if I don't take the K2 with the calcium to control the phosphorus, I'm going to have a buildup of plaque in my arteries again. And I really don't want that to happen. Because that'll kill you. That's the thing that kills you with kidney disease. It's not so much... Well, I mean, there's plenty of factors that can kill you, but that's one of the primary factors, is brittle bones. Brittle bones become like glass, and if you somehow manage to, make a wrong move or whatever, that very brittle, glass-like, thin-shelled, artery or blood vessel breaks, and you have a massive hemorrhage, and you die very quickly. I knew a friend who had a situation like that, and his wife, she said he got up in the middle of the night. He was coughing, severely. He was really coughing a lot. He got up to go to the bathroom, and he was coughing, and she said that all of a sudden she didn't hear any more coughing. And she waited maybe like 5 minutes. She's like, "What's going on?" And she went to the bathroom and saw Ronnie on the floor in a pool of blood. I don't know what happened, where the blood was coming from. Probably came out of his mouth. Just lying there in a pool of blood, dead. And so, it's not even about me, because I have no problem at this point in time with death. I'm kind of used to the idea that I might die any minute. And so, the Lord's given me peace about that. I know that, because I have received salvation through the blood of Jesus that He shed on the cross for me, I know that I have a home in heaven waiting for me. And I know that, the Father accepts me. I have been washed white as snow because of the blood of Jesus. Whoops! Sorry. And because of that, I don't really have any worries about dying. However, I worry about my family members having to deal with, my perishing. Maybe I die in the bed, or maybe I die like my friend Ronnie in the middle of the bathroom floor and there's blood everywhere. I really wouldn't want something like that to happen. And then, I leave my family members in turmoil. I mean, it's not bad enough that she died, but she died a horrible death. I don't want that to happen. That's a terrible thing. So, anyway, I'm going to continue to take the K2 to keep my blood vessels cleared. And, I want to say that in the past, I've taken ubiquinol, CLA, and grapeseed extract without having any problems. And so actually today, I took, for the first time in a long time, I took ubiquinol, which is a reduced form of CoQ10, and grapeseed extract. I took 1 pill of each kind. And I didn't take any CLA because I don't even know if there's any in the house. You take CLA for to reduce tumors, or to keep tumors from growing in your body of any kind. Ubiquinol is for heart health, and also tissue regeneration, which not have to be worried about the parathyroid. So I say not tissue, but cellular regeneration. And the grapeseed extract is to keep my blood vessels pliable so they don't harden. And it also helps with fluid balance so that your legs don't swell up and you don't have, you're not carrying around excess fluid in your tissue. So anyway, that's why I did that. I'm not sure about the ubiquinol. I think I might not take any more and wait until I take my next blood test to see what's going on with the PTH, and then I may or may not start doing that again. But I'm gonna take the grapeseed extract because that keeps the blood vessels supple and it helps with the fluid balance. Especially now that it's winter time, I noticed that in the winter I get more fluid buildup because, of course I'm not sweating as much in the summertime. In the summertime I'm sweating profusely. We don't have air conditioning. So in the wintertime we don't have, the benefit of sweating and releasing extra fluid through pores in the skin. So anyway, so I'm doing it for that reason. Anyway, I'm exceeding 16 minutes and I really don't want to go any further. So thanks for watching. Be blessed in your health.